MAT is medication assisted treatment. When used correctly, when used as a short-term solution to cravings, to withdrawal symptoms, when used correctly as prescribed as a taper, and when not overprescribed, MAT can be a huge tool that can help people to ease off of the dependence of illicit street drugs and move slowly and softly into being sober. Because to be honest with you, withdrawing hurts. Detoxing hurts. It hurts your joints. It hurts your bones. Some people get sick, like a cold or a flu, nauseous, throwing up, motion sickness, can't sleep, insomnia, vice versa. Different physiological reactions to different substances and from different genetics, meaning I could be withdrawing from opiates and I can't sleep, and someone can be withdrawing from opiates and they can't stay awake. I could be withdrawing from opiates and I can be throwing up every 5 minutes. Someone else could be withdrawing from opiates and they're overeating. They're eating food at every chance they get, just consuming nonstop. It's such a delicate topic. I don't think that any one medication would work for everyone. And I think that if you can do it without a medication, then you should try. I think it's worth trying to go without it prior to using it. However, with more of the rougher detoxes like alcohol, the rough detoxes and withdrawals like opiates, fentanyls, benzodiazepines, probably going to want to utilize MAT for those in a taper, meaning you start at a certain dose and you slowly decrease that dose over a relatively small period of time, 2 weeks or less, ideally. And if you've been on MAT for a long time, you have to taper off of that as well, and that taper is longer because if you've been utilizing MAT for, let's say, 1 year, you're not going to be able to taper off of that in a 2 week or small or less period. You're going to go through pain. You're going to withdraw. You're going to have physical pain. You're going to be nauseous. You're going to be sick, and all those same symptoms you would have from detoxing any other narcotic. So it can be beneficial. It is very helpful. It has saved a lot of lives. It should be taken with precaution. Clients should be educated. Patients should be educated on the risks and benefits of MAT. Our staff is trained to not continue to perpetuate the stigma and stereotypes that revolve around MAT. Just because a client is on MAT does not mean that they do not want to get sober. Just because they're taking Suboxone, buprenorphine, naltrexone, Vivitrol, or any of the other medications that are supplemented as MAT, prescribed as MAT, to not see those clients as not wanting to get sober, to not see those clients as wanting a head change, to not see those clients as still under the influence of a narcotic, but to see them as an individual who is making an honest attempt to get off of the illicit substance that they are addicted to, that has been causing them legal issues, that has been causing them family issues, that has been risking their health, that has been bringing them near death, sometimes even killing them, and luckily, hopefully brought back from that. Because there is a stigma. There is a lot of stereotyping. There is a lot of judging when it comes to MAT. All of our staff undergo an anti-stigma training for MAT because it is a powerful tool in this industry that can assist with the detox, withdrawal, and cravings. So if it works and if it helps, then we're all for it. At the same time, if it becomes a crutch and is hurting, then we will advocate for some sort of alternative. There are huge benefits of MAT to help with cravings, to help with withdrawal, to help with detox. But you have to consider the risk. Some people have described the detox from methadone, buprenorphine, Suboxone as being worse than detoxing from alcohol, heroin, or fentanyl. In fact, the detox and the withdrawal from the mat lasts longer and hurts more than the substances themselves. And that's something you really have to consider is medications can be abused the same way that illicit street drugs can be abused. Alcohol is a legal substance that gets abused all the time by many different populations. Marijuana in some states is a legal substance that is overconsumed in a lot of situations. Tobacco is a legal substance. Caffeine is a legal substance. All of these things can be abused. Just because something is prescribed does not mean that there is no risk in it. We have to advocate for the risks and benefits because unfortunately sometimes the doctors won't tell you about the risks and you won't realize it until it's too late. You'll be hooked on the medications and not even know it. So these are some things to consider when discussing the opportunity to engage in a MAT.